everyone. Thanks for joining us for Laid Back L&P Lessons. I'm Sachin Parikh.
I'm David Lieberman.
I'm going to talk to the master of the nose, Dave, and ask him some fun questions. So we're going to start with our first case. This patient comes in. I think it should be pretty clear to this person, to all of us, why she came in. But Dave, what do you see when you look at that nose on the front view, and what things that she may be concerned about?
So obviously this is a very beautiful young woman who, one of her primary concerns was that she had a crooked nasal appearance. So there's sort of a deviation, I don't know if it translates, but where there's sort of a reverse C shape to the nose. Things seem to be drifting in this portion off to her left and the tip a bit off to the right. And I think, you know, what you find in rhinoplasty, and it just comes up over and over again, is that if there's something that is a little bit out of place, the nose is crooked, a little bit oversized for a face, undersized for a face, it tends to just draw attention, and our brain is only capable of paying attention to a certain number of things. So if the brain is focused on the nose, then it's detracting from attention from other features like eyes, lips, jawlines, things like that.
So I know from talking to you and us discussing rhinoplasty, and when you kind of call me in there for a second set of eyes, one of the toughest parts of noses is the tip. Mm-hmm. And when I look at this patient's tip on the after image, I think it's amazing. You know, symmetric, natural. Give me your thoughts, because I know a lot of people come in with certain perceptions of what they want their nose to look like. And we have a conversation about the aesthetic that we try to achieve here at L&P. But I want you to tell me what you see in this tip that is drawing me to it.
I'm flattered. Thank you. Okay, so first, volume. You know, tips don't have to be sharp. In fact, they shouldn't be. They should have certain volume in the right places. It's not always about reduction. And you really want to preserve some volume in the actual true tip portion. And, you know, there's a little bit of a lift to the tip. It sits a little bit closer to the face. But also there's sort of a slender line moving down the bridge. But then when it gets to the tip, it kind of flares out. So you're holding volume in the right places. And I think in terms of, you know, so what you see here is a little bit of increased rotation, a little bit of deep projection, a little bit closer to the face. Then also, you know, without there being kind of a scooped appearance, there's that sort of lift, so the tip still lifts off from the nose, but it's not about ski slope. In fact, this is sort of the way that our noses are designed. If you look at cartilages on, you know, under the skin, where the tip cartilages kind of sit on top of the rest. And then if you look at the front view again, you see that kind of nice sort of slender line in the middle, but when it gets to the tip complex, it flares a little bit. So again, that helps to really keep that natural look to a nose.
Well, thank you for joining us for this amazing L&P laid back lesson. I hope you got a lot out of it. This nose, this transformation was awesome. There are going to be more to come, whether it's noses, eyes, face. We're looking forward to teaching you, learning with you, growing with you, and we hope to have the opportunity to take care of you.
Thank you.
Laid back.